let's get into menopause, the big pause. The big pause. First of all, how do you know when you are actually in menopause versus being perimenopausal versus being postmenopausal? Like, what is menopause?
Hey, menopause, as I define it for my patients, is the pooping out of the ovaries. That's what it's about. When somebody is having periods, in other words, she hasn't had a hysterectomy or she doesn't have an IUD and that keeps her from having periods or something like that, you can say you are menopausal when you go a full year without having a period. Okay.
Any bleeding or a period?
No bleeding at all. No bleeding. Even a little bit of light bleeding counts, and you got to reset that clock. So even a little bit of light bleeding counts. Doesn't have to be a full period. Okay. So you go that year without a period or significant bleeding, you can say, yep, I am fully menopausal. Okay. Until then, but the key thing is you can have all the fabulous symptoms of menopause, the hot flashes, the night sweats, the insomnia, the achiness, vaginal dryness. We can keep going. You can have all those fabulous symptoms even before you skip the period, let alone start getting erratic periods. Oh. And the erratic periods can go on for quite a while, unfortunately. And the problem is, let's say you go 6 months without a period and you say, oh, I'm getting there. Bingo, you get a period. Well, it's not another 6 months to put in the clock. It's a full year. You have to say, okay, I have to wait another full year to say I'm fully menopausal. Okay. Now, the key thing is that doesn't mean that you have to wait until you've gone a full year without seeking intervention. If you haven't slept a night, I don't care whether you're having skip periods or not having skip periods, we got to help you. We got to make you get some sleep. So that, intervention is certainly fine, but we just can't say you're technically fully menopausal. And the other thing that I always like when we talked about fertility in older folks, well, the thing to remember is that until you go that magic year without having a period, without anybody else keeping you from having a period, that you can't say to somebody she's not going to get pregnant. And in my personal experience here, I personally have delivered 3 women at the age of 47 who were not in vitro patients. They were people who were like, oops, pregnancy. Wow. So I've delivered 3 47-year-olds. It can happen. So anyway,
now, when you say the erratic period, that sounds terrifying. That's basically going back to when you're 12 or 13 and you don't know when the period's coming and you haven't figured out, like how to prepare for it. And the next thing you know, you have an embarrassing moment in gym. Like, what's the erratic period?
They can go from 2 weeks, they can go to 6 weeks or 12 weeks or 8 weeks. They're all over the place.
Okay. Well, that's a nightmare. And how do you regulate that?
Well, we can do this, okay? Because the key thing that's going on is that actually the erratic periods are more of a problem of less progesterone. Progesterone is the hormone our ovaries make when we ovulate. And one of my buddies, Dr. Nanette Santoro, always says, I just tell my patients that the lining of the uterus is like a lawn, and estrogen is like fertilizer, and progesterone is the lawnmower. And I think that's a pretty good analogy about what's going on. So estrogen feeds the growth of the lining of the uterus, and the progesterone goes in there and regulates it and cleans it out. And so we can oftentimes take these women who are having crazy bleeding all over the place and give them some progesterone in a manner to regulate their cycle. So we can do that without using estrogen. However, a lot of times when people are getting their wacky periods, they are also junk that people get that makes them uncomfortable. And there are a couple of tricks that we can do very nicely for folks to get them through perimenopause. And for example, a low dose, you mentioned being on the low dose birth control there, Megyn. And so that can be a friend of yours for controlling crazy cycles. And a low dose pill can be very, very helpful. And the nice thing about a low dose pill, besides having a synthetic progesterone in it to keep the bleeding under control, it also has estrogen there. So if you're getting hot flashes, night sweats, sleep craziness, that will help take care of the crazy sleep and the crazy periods. So low dose birth control pills can be a real blessing in the
How long can you stay on them, though? How long can you stay on them?
If you're not a smoker, now if you're a smoker, you don't want to be on it. You cannot be on it. Okay, beyond the age of 35, smokers should not be on the pill. Now, of course, I tell people, let me help you to stop smoking, then I can give you the pill, because I really am an advocate for stopping smoking if we can. So the key thing is that you can stay on them forever, to be honest. Well, not forever. There are patients that I put on the pill, and I always tell this to somebody that I'm putting on the pill for perimenopausal control. I will not know when your ovaries have officially pooped because the pill will keep giving you periods. Okay. So I don't know whether they're, what your own ovaries are doing because it's masking them. But my usual statement to my patient, but do you really care if you know exactly when you're stopping your periods? You don't care. You want to be comfortable and you don't
But
want to bleed.
I thought that once you hit like right around my age, 50, 52, 53, that you couldn't stay on the birth control pill anymore because of the risk of blood clots and or heart attack. And there was something to the effect that you mentioned synthetic, like that's an issue, taking synthetic. And I don't even remember whether it's the estrogen or the progesterone. But can you talk about that?
Sure. The issue is that you're absolutely right. There is an increased risk of blood clotting the older we get, which is why we tend to like to use very low dose pills rather than using a high dose pill. And in general, try to minimize that risk of clotting. However, there is no one age to say, okay, you were 54, you should go off. Okay. What I will often do though, because the key question is we don't know if you're fully menopausal. And the key thing that most women don't realize is that birth control pills actually have much more estrogen than quote unquote hormone replacement therapy or hormone therapy, that the pill is actually more estrogen. So if somebody is on the birth control pill and we really don't know whether she's menopausal or not, what I will often do, and I will use, like, for example, family history. If she says everybody in my family went through menopause at age 48, okay. I mean, that doesn't guarantee that she's going to be menopausal at age 48, but that's a guide. So we may stop her at 48 or 49 and say, okay, are you menopausal? You go off the pill, see what your hormones are doing on your own. If she says everybody in my family went through menopause at 57, we may try at about age 55, presuming she's totally happy, and see where she is. But if she's not, we can put her back on the pill if she wants to be back on the pill.
Is hormone replacement therapy like it's estrogen and progesterone, right? But is that just a lower dose of what's in the pill?
It's a much lower dose. Yeah, it is a lower dose. Now, the one thing that we can say is that with the birth control pills, there's a slightly different estrogen in general in the pills than what's in the hormone therapy. Not dramatically different. I mean, it accomplishes the same thing. In the hormone replacement therapy, hormone therapy view of using progesterone, there are some natural progesterones that we can use for hormone replacement therapy. And some people do prefer them to the synthetic progestins. So again, we can come up with a nice friendly combination for low dose hormone therapy. If somebody says, I really like my estrogen and my progestin, but if you don't need it, then by all means, you don't need to take it.
Is that a same question on that as we did on the testosterone? Is there a shelf life for how long you can take HRT?
No. The honest answer is no. Basically, the key thing is, and again, you want to revisit these things with your provider, and you want to talk to a provider who knows something about menopause. Okay. For a while, back after the Women's Health Initiative came back in 2002,
that's the thing that raised all the concerns about HRT that led people to say, I'm not doing that. And basically now women got screwed for 20 years, not even being offered HRT.
Yeah, well, we can talk more about that too. But anyway, around that time that folks realized that the increased risk of breast cancer seemed to manifest itself in this study after about 5 years of use, okay, in women who were taking estrogen plus progestin. And so a thought arose among many providers, okay, it's okay to take it for 5 years, but then you want to stop because that's where you have your increased risk of breast cancer. Well, the answer is it was a very, very minuscule increased risk of breast cancer, and there are ways we can minimize those risks so that really I think this 5-year mark has now sort of become passé. And the official mantra of the Menopause Society, the former North American Menopause Society, is basically it used to be take the lowest dose for the shortest duration of time. That was the official mantra. The official mantra now from the Menopause Society is use the appropriate dose for the appropriate duration. And so the key thing is you need to be visiting, with a provider who knows something about menopausal therapy, menopausal hormone therapy. And if people are doing well and they really seem to be thriving and everything's to be fine, they may stay on it.
Summer used to mean I was kicking off the sheets every other night to try to stay cool. I don't know about you. But that all changed thanks in part to my discovery of Cozy Earth bedding. Now I'm sleeping comfortably even on those hot, awful nights. And you can too. Simply swap out your current sheets for soft, breathable, temperature-regulating sheets from Cozy Earth, the brand with thousands of 5-star reviews, including my own. If you don't agree that you are sleeping cooler and more comfortably this summer, they will refund your purchase price, no questions asked. Also, your shipping. And you get 100 nights to try them out. How can Cozy Earth make such a guarantee? Because their bedding is made from viscose, from bamboo, so it traps less heat, enabling people to sleep cooler and more comfortably year-round. For a limited time, save up to 40% on Cozy Earth. Go to CozyEarth.com, enter my promo code Megyn at checkout, and save up to 40% right now. Try them for 100 nights. If you don't sleep cooler, send them back for a full refund. CozyEarth.com, promo code Megyn. Hey, thanks so much for watching. If you like what you just saw, hit the subscribe button for more clips and full episodes.